Today's topic is submandibular region. Many important structures are present in this region. Now the extension of that region from where to where is called submandibular region. Submandibular means it should be below the mandible, right? So it should be below the mandible up to what extent? Inferiorly, it is up to the hyoid bone. So from hyoid bone to the mandible. Now it is not lower margin of the mandible, but it extends above it on the inner aspect of the mandible, right? Though it is called submandibular region, but it is not strictly below the mandible. It also extends to some extent deep to the deeper surface of the mandible, body of the mandible, right? So this is the region of the submandibular area. Now here you will get the following muscles, and that muscles they are present in different layers. They are not at the same plane, they are from different layers. So from the deeper aspect, I am coming to the superficial aspect. Most deeper aspect lies Genioglossus, geniohyoid. Have you completed mandible? Posterior mandible हुआ? नहीं हुआ अभी. Here at the inner aspect of the symphysis menti. Actually, it is not original bone. That's why it is not present here. Actually, this is called symphysis menti. On the inner aspect of the symphysis menti, there are two tubercles. Here it is not present. There are two tubercles. It is called genial tubercle. There are two tubercles. One is called upper and one is called lower. So from the upper genial tubercle, the genioglossus muscle takes origin and it goes towards the glossus, means tongue. And from the inferior genial tubercle, another muscle comes out and is go towards the hyoid bone, that is called geniohyoid. So genioglossus, geniohyoid, and most posteriorly another muscle is there, that is called constrictor muscle, that is called middle constrictor. I have not yet drawn here. This is called middle constrictor. So these are the deepest layer. So at the deepest layer lies genioglossus, geniohyoid, and anteriorly, and posteriorly lies the middle constrictor. This is the deepest layer. Now come to the superficial aspect. Here lies two muscles. Styloglossus, it takes origin from the styloid process and comes to the tongue, that is called styloglossus. Styloglossus and hyoglossus. These two muscles comprise the middle layer, and most superficial layer is mylohyoid muscle. Most superficial layer is mylohyoid muscle. You have seen in the dissection mylohyoid muscle. As you have seen the superficial part of the submandibular gland, that lies on the superficial surface of the mylohyoid muscle. And on the mylohyoid muscle, you have also seen the anterior belly of the digastric. You have already seen that, right? If you not yet have seen, today you will see. that there is two belly. I have shown clearly the posterior belly. Anterior belly also there is anterior belly that lies over the mylohyoid muscle, right? So this is the arrangement of the layer, right? Now one question will come here, that is the submandibular gland. If you want to describe the submandibular gland, and if you do not know the arrangement of the muscles and vessels, you will not be able to describe the relations of the submandibular gland. You know submandibular gland, what type of gland? Salivary gland. It is mixed salivary gland. Why it is called mixed? Why it is called mixed? Serous and mucus acinus, both. There is serous and mucus acini. Which one predominates? Not mucinous. No, serous predominates. Serous and mucus acinus is present. That's why I call it is the mixed gland. 80% of the salivary calculi. What is that? Stone. Calcium stone. Calcium stone is formed within the duct of the submandibular gland. 80% calculi is formed within the submandibular duct, right? And 80% of it is radio opaque. What is meant by radio opaque? If you take a straight X-ray, plain X-ray, it will be shown. As it is radio opaque, you can see it in the X-ray. So 80% stone is formed here because the secretion of the submandibular gland is viscous, viscid. It is not watery. As it is mixed gland, so its secretion is viscid, thick. Because of this thick mucous membrane, and this secretion also contains high concentration of calcium. Because of these two factors, thick secretion as well as it contains high concentration of calcium, that's why this calcium stone, 80% calcium stones is formed within the submandibular duct, right? Now this submandibular duct, if comes as a short note or as a question, but you have to describe. How you will describe? This gland actually has got two parts, superficial part and deep part, right? Superficial part you have seen, that superficial lies over the mylohyoid muscle. Now the deep part, this muscle, this gland at the posterior aspect of the mylohyoid muscle, posterior border of the mylohyoid muscle, it invaginates into the deep to the mylohyoid muscle. That means between mylohyoid and hyoglossus. I have already told you hyoglossus is the middle layer and superficial layer is mylohyoid. So if deeper part, it actually posteriorly along the posterior border it winds and enters into the deeper aspect of the mylohyoid muscle. That means mylohyoid and hyoglossus. That is the deeper part, right? It is small part. It is small part and thin. So it lies here. Now the superficial part, it extends from the first, it lies mylohyoid, then just behind the mylohyoid lies hyoglossus, and just behind lies the middle constrictor. These three muscles lies, but they do not lie on the same plane. They lie in different planes. Superficial plane, mylohyoid, then deeper plane is hyoglossus, then deepest plane is the superior middle constrictor. So the deep surface of the superficial part lies over these muscles, right? So this is the relations. Now superficial relation, what is the superficial relations? This gland, if you take coronal section, this gland, if you take coronal section, it has lateral surface, medial surface and inferior surface. Three surface. Now the lateral surface lies in contact with the this part. This is the mylohyoid line. Here takes are in the mylohyoid muscle. This part is called submandibular fossa. So laterally lies the submandibular fossa, right? And now I am describing the covering of the superficial surface, that means lateral surface of the gland. So if we come from skin to the gland, first you will get skin. Here is skin and with superficial layer, that means superficial layer with platysma, and deep to platysma you will get the superficial nerves, right? Vein and one branch of the facial nerve. What branch of facial nerve you will get here? Cervical. The cervical branch of the facial nerve you will get vein, common facial vein. You will get within the superficial layer. Then after superficial layer you will get deep fascia. The which layer of deep fascia? Investing layer of deep cervical fascia. Right? I have already described many times that deep fascia of the neck consists of three layers, from superficial to deep. There is an investing layer, then you will get pretracheal layer, and then you will get prevertebral layer. So it is the investing deep cervical fascia. This deep cervical fascia here it splits. One layer is attached lower margin of the mandible, and other will cover the medial surface of the gland and will be attached to the mylohyoid line. Right? Within this capsule means formed by this investigative deep cervical fascia. Within this, you will get some lymph node, submandibular lymph nodes. Why it is important? Submandibular lymph nodes, in many occasions, in many diseases, they become enlarged. Now, I have already told you how you will distinguish whether this swelling at the submandibular region, whether it is the swelling of the submandibular salivary gland or submandibular lymph node. How will you distinguish it? By bimanual palpation. Bimanual palpation. One finger you will place outside and one finger you will place inside the mouth and you will press. If it moves, the whole mass moves, that means it is the submandibular salivary gland. And if it does not move with the palpation, that means it is the submandibular lymph node. Right? So this is the submandibular lymph node and submandibular gland, bimanual palpation. Right? Now, this gland has anterior end and posterior end. Three surface: superficial surface or lateral surface, inferior surface and medial surface. Now it has anterior end and posterior end. Anterior end extends up to the anterior belly of the digastric, and posterior end extends up to, I have already told you, there is an important ligament. That ligament separates the submandibular gland with the parotid gland. What is the name of that ligament? Stylomandibular ligament. Very good. Stylomandibular ligament is the condensation of the investing layer of deep cervical fascia, which extends from the styloid process up to the angle of the mandible. So up to that. So this ligament actually separates the posterior aspect of the submandibular gland from the parotid gland. Right? And there is another important relations at the posterior end of this gland. That is one important artery, that is called facial artery. Facial artery, after coming out from, facial artery, branch of external carotid artery. এতবার বলা সত্ত্বেও যদি না পড়তে হয় কি হবে? External carotid artery, from its anterior aspect, it gives up three branches. First, superior thyroid, then lingual, then facial. This facial artery, after coming out from the anterior aspect of the external carotid artery, it actually makes a groove on the posterior superior aspect of the submandibular gland. Then it makes a loop. After making loop, it descends downwards between the superficial surface or lateral surface and inner surface of the mandible. Here. Then it comes to the lower margin of the mandible. Here again it takes turn at the anterior margin of the mastoid process and it enters the face. বুঝতে পারলি? So this is the facial artery. So facial artery actually comes twice in relation to the mandibular gland. One at the posterior superior aspect of the posterior superior end of the salivary gland, and another it comes on the lateral surface of the superficial part of the salivary gland. Right? So this is the. Now come to the deep part. Deep part lies between which layer of the muscles? Between mylohyoid and hyoglossus. It will lie between mylohyoid and hyoglossus. Deep part. Right? Now this hyoglossus muscle, now I will describe the muscles later on. Now after I complete now for submandibular gland. Now this deep part is a small part. It is small. Actually, it is the half of the parotid gland. The size of the submandibular gland, it is half the size of the parotid gland. About 10 to 20 gram in weight, walnut shaped. Now submandibular duct. Now come to the submandibular duct. Submandibular duct, it is also 5 cm in length. You also have seen that the parotid duct also 5 cm in length. Both are 5 cm in length. One is called Stenson's duct and another is called Wharton's duct. Wharton's duct. Submandibular duct is known as Wharton's duct and parotid duct is known as Stenson's duct. Now this duct, Wharton's duct, it is coming from the which part of the submandibular gland? From the deeper part or superficial part? It is actually coming from the superficial part. Just near the posterior margin of the superficial part it comes out and it passes through the deep part and enters and opens into the side of the frenulum. If you raise your tongue, there is a raised area, that is the frenulum. At the lower end of the frenulum, there is a papilla, lingual papilla. At the summit of the lingual papilla, it will open. Right? গিয়ে আয়নার সামনে দেখবি লিঙ্গুয়াল প্যাপিলা, আগে মুখে একটু টক কিছু দিয়ে দিবি, একটা লেবু দিবি, দেখবি এই দিকে সারাগা বেরোচ্ছে, সারাগা বেরোবে বেরিয়ে, বুঝতে পারলি? So this is the opening of the submandibular duct. Now another important structures, that is structure which lies on the hyoglossus muscles. It is very important. What are the important structures lie on the hyoglossus muscle? I will draw it separately. Hyoglossus muscles. If you are asked what are the muscles of the submandibular region, name some muscles of the submandibular region. Xylohyoid, Genioglossus. If you categorize it, suprahyoid muscles. First you describe suprahyoid muscles. Above the suprahyoid, there are some muscles, infrahyoid muscles. What are the suprahyoid muscles? That suprahyoid muscles all will come in the submandibular region. What are the suprahyoid muscles? Number one, posterior belly of the digastric. Posterior belly of the digastric. Right? Stylohyoid muscle, mylohyoid muscle, geniohyoid muscle. जो hyoid से end होता है, they are all suprahyoid. Infrahyoid from below coming to the hyoid, they are infrahyoid. जब in superior below to hyoid, they are infrahyoid, and which is coming from above, that is suprahyoid muscles. So these are the suprahyoid muscles, right? If short note comes suprahyoid muscles, first of all you should enumerate what are the number of the suprahyoid muscles. Posterior belly of the digastric, then stylohyoid muscle, mylohyoid muscles, geniohyoid muscles. Right? Now come to the extrinsic muscles of the tongue. Extrinsic muscles of the tongue. They are styloglossus. It will end in glossus. So from stylar process to the tongue, styloglossus. From genial tubercle to the glossus, genioglossus. From hyoid bone to the glossus, hyoglossus. So these are the muscles that is called extrinsic muscles of the tongue. All come within the muscles of the submandibular region. Right? Now another now I will describe the structures that lie on the hyoglossus muscles. Hyoglossus muscles. Hyoglossus muscles are actually quadrangular in shape. As it is glossus muscles, so it will go to the tongue, side of the tongue. From the posterior half of the tongue, there it interdigitates with the styloglossus muscles, and below it is attached to the hyoid bone. Now many important structures lies within the superficial surface of the hyoglossus muscles. That means between hyoglossus and mylohyoid muscles. If we remove the mylohyoid muscles, you will see all these structures. Now what are these structures? I will now show you here. First structure from above downwards. Here I have already told you, it lies the posterior half of the tongue. It interdigitates with this muscle. That muscle is styloglossus. So here it interdigitates. Now on the surface I have removed the mylohyoid. Now what are the structures you will find on the hyoglossus muscles? Number one, you will get lingual nerve. Lingual nerve is one of the division of the mandibular nerve. First of all, you will get lingual nerve. Most upper structure, lingual nerve. From the lingual nerve, one important parasympathetic ganglia hangs. Pinhead size parasympathetic ganglia hangs from the lingual nerve. That is called submandibular ganglion. Submandibular ganglion. Submandibular ganglion. Now below the submandibular ganglion, you will get deep part of the submandibular gland, salivary gland, deep part. I have already told you that deep part lies between the mylohyoid and hyoglossus. So deep part, here you will get deep part. And you know the submandibular duct, it is originating from the superficial part, but it is actually passing through the deep part. So here you will get submandibular duct. Below the deep part of the submandibular gland, you will get another important nerve, that is hypoglossal nerve. Hypoglossal nerve. This hypoglossal nerve is accompanied by vein, that is called vena comitans nervi hypoglossi. But you have already, you are acquainted with this term, vena comitantis. What is called vena comitantis? If suppose there is an artery here, and if it is accompanied by on either side vein, suppose it is accompanied by either behind, we will call it vena comitantis of this artery. Likewise, here the nerve is accompanied by vein. It is called vena comitantis of hypoglossal nerve, but nervi hypoglossite. If you describe it, it will, that is called hypoglossal nerve with vein, accompanying vein. Right. So these are the structures. If you are asked what are the structures on the lateral surface of the hyoglossus muscles from above downwards, they are lingual nerve. Lingual nerve is coming from mandibular division. Then it is the deep part of the submandibular salivary gland. Then you will get hypoglossal nerve. Hypoglossal nerve, all muscles of the tongue will be supplied by the hypoglossal nerve, except palatoglossus. Now, so these are the structures, right? Now you will be asked to describe the ganglion. Whenever ganglion will come, from the ganglion actually secretomotor fibers go and supply the submandibular gland. All gland is supplied by secretomotor fibers. Their stimulation will cause secretion. Now, at this moment, you will not be able to appreciate. After completion of your brain stem, then you will be able to understand. So I am not going into details. Actually, it need not remember it. It is coming from the superior salivary nucleus. From the superior salivary nucleus, it will come through the facial nerve. From the facial nerve, then it will come to this gland through cauda tympani nerve, and it will relay here, and from there postganglionic fiber will come out and will supply directly the submandibular gland. Right? So you need not remember this now at this moment. So just you remember all these structures which lies on the outer aspect of the hyoglossus. Now lingual nerve, now lingual artery, where lingual artery lies. Sometimes lingual artery comes as a short note. Lingual artery lies deep too. Lingual nerve lies superficial to the hyoglossus muscle, but lingual artery lies deep to it. If you remove it, then you will get lingual artery. Right? So I am drawing it with dotted lines. Dotted lines means it lies deep too. Here lies the lingual artery. Lingual artery is a branch of external carotid artery. How will you identify this lingual artery? It will be accompanied by hypoglossal nerve. Actually, it makes a loop, and this loop is crossed by hypoglossal nerve. So this lingual artery actually passes deep to the hyoglossus muscles. It gives a first branch. Before entering into the hyoglossus muscle, it gives a branch that is called suprahyoid branch that will pass along the hyoid bone. This is the suprahyoid branch. And when it is within the, actually this muscle, hyoglossus muscle divides this artery into three parts. One is proximal to the distal border, the posterior border of the hyoglossus. This is the first part. Second part lies deep to it, and third part lies anterior to the anterior border of the hyoglossus muscles. Right? Now, first part gives one branch that is called suprahyoid branch, and the part which lies deep to it, from here the branch comes out, that is called dorsal lingual artery, right? And from the part anterior to the hyoglossus muscle, here it is the deep and sublingual artery. It is the deep and sublingual. So from the third part, two branches, at a deep lingual artery and sublingual artery, right? So these are the artery of the lingual artery. Now come to the muscles. Some important muscles you should know, because that may come as a short note. Number one is what is the key muscle of the neck? What is the key muscle of the neck? Which muscle is called key muscle of the neck? I mean, in case of anterior triangle, which one is the key muscle? Bolo. Actually, deep to this muscle, important neurovascular structure is passing. Deep to this, important neurovascular structure is passing. That's why it is called key muscle. What is that? Bolo. Posterior belly of the digastric. Because deep to it, important nerves and vessels are passing. What are that important vessels? ডিসেকশনও দেখিস না, আমি দেখি চুপচাপ বসানো গল্প করিস। ডিসেকশন দেখেছিস? কালকে দেখালাম, দেখেছিস? খিলিস না? External carotid artery, internal carotid artery, internal jugular vein, and vagus nerve, hypoglossal nerve, accessory nerve. So these are the important structure that pass deep to it. বুঝতে পারলি? তাহলে এখানে অপারেশন করতে গেলে সার্জেনকে ওইগুলো সব খেয়াল রাখতে হবে। একটা কেটে গেলেই শেষ, কম্পেনসেশন দিতে দিতে তার টাকা সব শেষ। কম্পেনসেশন, আমার যদি কেটে দিস একটা লাভ, আর আমি যদি ইম্পেয়ার্ড হয়ে যায় আমার কোনো ফাংশন, তাহলে আমি লজ এ কেস এগেনস্ট ইউ। আমাদের দেশ তো কেস হয় না, বুঝলি? তাহলে কতটা ইম্পর্টেন্ট জায়গা মনে রাখবি। Sometimes you may be required to take lymph node from here. at the time of taking lymph node, if you injure this important structure, then you will be incriminated for that. Now, that muscle is important, that is sternocleidomastoid is important, but key muscle is called posterior of the digastric. And at the time of this muscle, if you come as a short note, this is sternocleidomastoid. Its action, I have already told you. What is its action? What is the action of the sternocleidomastoid? Well, first you will describe if one muscle contracts, then you will describe if two muscle contracts at the same time. If it acts from above, when above point is fixed, lower point is moving, and again you have to describe the lower point is fixed and upper point is moving. In this way you have to describe the function, action of the muscle. Now if unilaterally it contracts, suppose this muscle is contracting, then what will happen to this?
It pulls the head towards the same shoulder.
Huh?
It pulls the head towards the same shoulder.
It tilts the head towards the same shoulder. If unilaterally contracts, it will tilt the head towards the same shoulder, and chin, this one,
And rotates the head, carrying the face to the opposite shoulder.
and chin will opposite side. Like this. Chin will move to the opposite side. If one muscle contracts, right muscle contracts, your chin will move to the left side. Neck will flex to the same side. Right? If both muscle acts from below means here it is fixed, then you will be able to raise your head. You will be able to raise your head from pillow. If above point is fixed and if it contracts, then it will raise your thoracic cavity. It is come as a accessory muscle of respiration. যখন খুব স্ট্রং রেসপিরেশন দরকার তখন it will come into action. And another important function, that is this muscle flexes the neck and extends
Cervical part of vertical column.
This joint, which is called temporomandibular joint. It extends the temporomandibular joint and flexes the neck. This movement, when it will come to use, এই মুভমেন্টটা কখন লাগে? When this movement will come to your use, আমি বলেছিলাম আগে, neck will flex, but এরকম horizontal gaze ঠিক রেখে এরকম করছি, তো কী করবি? Suppose you are short height, someone taller person in front of you, you are trying to see above his shoulder, then this function will come. It will flex and it will extend like this. বুঝতে পারলি? Now come to the তাহলে হায়োয়েড মাসল বলে দিলাম। হায়োয়েড মাসলের অরিজিন বলবি from the hyoid bone. If you do not remember from which area of the hyoid bone, you should not describe. You should go from the lower hyoid bone, and above it will go to the side of the tongue, and it intermingles with the styloglossus muscles. It is quadrangular in shape, and when it will contract, it will depress the side of the tongue, and when it will contract from above, it will raise the hyoid bone, right? And important structure lies on its surface. We will describe all these three, right? Now come to the styloglossus. It is coming from the styloid process, posterior aspect of the styloid process, and it is going to the side of the tongue, interdigit with the hyoglossus, and when it will contract, it will pull the tongue above and backwards, styloglossus, right? Now genioglossus is a fan-shaped muscle. It is taking origin from the upper genial tubercle, and it is going to the ventral surface of the tongue. When this muscle will contract, what will do? It will draw the tongue forwards. It will draw the tongue forwards. Right. Then let us summarize. What is submandibular region? Submandibular region is the region, it lies, it extends from the hyoid bone up to the inner aspect of the body of the mandible. What are the important muscles within this region? You have to describe all these muscles, suprahyoid muscles, external muscles of the tongue. What are the important structures? Nerves, क्या nerves है? Number nerve होते hypoglossal nerve, lingual nerve, and nerve to mylohyoid. These are the nerves. Important vessels, that is lingual artery, facial artery, vein, facial vein, lingual vein. Important glands, that is submandibular salivary gland and sublingual glands. I have not yet described the sublingual glands. Sublingual glands right below the tongue. They open 8 to 18. There are 8 to 18 ducts that directly opens in the floor of the mouth. Some ducts may open through the submandibular duct. Right. This is the submandibular sublingual gland. So these are in short the submandibular region.